Assessment. First thing you're going to get is a scenario. Actually, what we're going to do is I'm just going to first give her instructions as an EMT. Basically, the call is going to come in. Your call is that you are answering a call to a report of chest pain. That's all you have at the moment. When you arrive on scene, you find this man sitting on the front steps of his house. He's awake and alert, able to speak to you. He's leaning forward. He appears to be in pain. So you go ahead and take action.
BSI.
BSI.
Is the scene safe?
Scene is safe.
How many patients do I have?
Just one patient.
Do I need additional resources?
ALS is on standby.
Do I need to maintain C-spine?
C-spine is not needed in this situation.
Okay. Go ahead.
Go ahead. Take action.
Hey, sir, I'm Staff Sergeant Owens. I'm from the EMS.
Oh,
What's going on with you today?
my chest hurts.
Your chest hurts?
Yes.
Where does it hurt at?
All over. I was just out running and it started hurting.
Okay.
So I stopped here at the steps and it really hurts now.
Okay, on the pain scale of 1 to 10, 10 being the strongest, what is it?
It's a 10.
Okay.
So what's your general impression of the patient?
Old
He's
man.
having some type of cardiac compromise.
All right, so his level of consciousness is what?
He's alert and responsive. He's able to talk to me.
Good.
He has a patent airway.
Excellent.
He's breathing.
Okay, what
But
do
what
you
is
want
his
to know?
respiratory rate?
His rate is around 24 and shallow.
What is his quality?
He's a little bit wheezy, but otherwise he's breathing all right on his own, but he looks like he has more chest pain.
Okay, I want to go ahead and auscultate his lungs. Starting at the apex, what do I hear?
Clear, clear, a little bit of wheezing in the bottom, a little bit of wheezing on that side.
Okay. All clear in all fields?
All clear except just a little bit of wheezing in the bottom
Okay.
lobes.
Okay, now I'm going to go on to circulation. Does he have a carotid pulse?
He does have a carotid pulse.
What is it?
The rate is approximately 110,
Okay.
a little bit thready.
And thready, okay. I'm going to go ahead and check his radial pulses. Are they present?
They're present, roughly about 90.
Okay. I'm going to check his skin temperature. I mean, how does he look?
He looks a little pale,
Is he sweating?
a little bit diaphoretic,
Okay, got it. What is his temperature on his skin? Is it
a little clammy and cool.
clammy and cool? Okay. I'm going to go ahead and start with his, I'm going to go ahead and determine his transport level. Actually, I'm going to go back to airway, and I'm going to put him on oxygen.
Okay.
A non-rebreather at 15 liters, high flow O2.
Good.
Okay. Does that seem to help him?
Looks like he's feeling a little bit better.
What's his respiratory rate?
Still around 22.
Okay. Alrighty. So at this time, I've determined that he's a load and go.
Okay, good.
Because he's unstable and I'm not, it may be out of my control. He may need to go higher to definitive care and get some workup done. But it's out of my control as an EMT.
All right, so your next step, you want to get a history on him, right?
I want to get a history, so I'm going to start with the OPQRST. Sir, when did this onset happen?
About 20 minutes ago.
And what did you say the pain was again?
10.
It's still there with all?
Oh, it's right all in here.
Is it still a 10 with the O2?
It's about a 9 with those. It's getting a little better.
Okay.
Feels a little edge off.
What is his rate?
His respiratory rate?
Yeah.
Still around 20, 22.
Okay.
Hasn't come down that much. He's still having a tough time.
So severity still at about a 9?
Ask him.
Okay. What is it?
It's about a 9.
Okay.
10.
Got it. And time, you said it happened about 20 minutes
About
ago?
20 minutes ago.
Okay. So then I'm going to go on to his sample history.
Okay, good.
Okay? So we know that his signs and symptoms are he's complaining of chest pain and is radiating where, sir?
All down, it's in my arm, goes all the way through my left arm, and then up here in my jaw. Oh, feels like I got punched.
Okay, and we know it went down, his pain level went down to a 9. I'm going to go ahead and ask, sir, do you have any allergies?
No.
No allergies at this time. What about medications? Do you take anything?
Well, they gave me some little gray pills last year when this happened.
Can you tell me where they are?
Yeah, they're right here next to me on the box.
Okay, let me check that, see what that is. What's your name, sir?
Fred?
Fred?
Let me
And
cough.
this is nitroglycerin 0.2 sublingual. So I see you take this under the tongue. Have you
Yes,
had
yes,
this in a
ma'am.
while?
No, it gives me a horrible headache.
Give you a horrible headache. Okay. All right, so we did the medication. Do you take any other medications? No. P, pertinent past history.
I had one of these instances about a year ago.
So you have a history of having chest pains?
Yeah, angina.
Angina. And what do you normally do for it? You take that medicine, and do you take it regularly?
Only one they make me.
Okay. Okay. And your last oral intake?
Dinner last night.
Okay. Not affecting what's going on here? Never have. Okay. And events leading up to that, you told me you were?
Got run. Get ready for that PT.
Okay. So what I'm going to go ahead and do is I want to call medical director and see if I can get the okay. First of all, I want to check his blood pressure again.
All right, so you want to get a set of vital signs on him again?
Exactly. Because I'm reassessing him every 5 minutes.
Okay. Don't bother pumping it up. It's fine. Just
What's his blood pressure?
Blood pressure is 160 over 98.
Okay. So I'm gonna go ahead and call medical director. Medical director,
All right, this is medical control.
I have a 58-year-old male here.
Jeez.
You're only 2 years away from retirement
4 years now.
for the Army.
I have a 44-year-old male here who's presenting with chest pain on a pain scale of 1 to 10. He's presenting at a 9. I have him on O2 15 liters non-rebreather. That seems to be helping him some. He does take the events leading up to this. He was running and he had to stop midway and come back. As he came back to his house, it got worse on exertion. So he takes normally nitroglycerin 0.2. He hasn't had any in a while because he said it makes his blood pressure, it makes him feel a little bit dizzy. So I just want to know at this time his blood pressure is.
Okay, blood pressure, you already gave it, so I told you 160 over 98.
Do I have permission to assist him to take his nitroglycerin?
All right, vital signs received. If the patient is able to, you may assist with the nitroglycerin.
Okay. I'm going to go ahead, sir, and assist you with taking your nitroglycerin. You're going to take one, and then you're going to, for 5 minutes, and then I'll, under his tongue, it'll dissolve, and I'll recheck him in 5 minutes. And I'm rechecking his blood
All right,
pressure.
5 minutes has gone by.
Okay, so he's a load and go. He's gone.
All right, blood pressure is now down to about 140 over 88.
Okay, sir, at this time, do you want to go to the hospital?
Yeah, I think I better.
Okay. All right, that is the end.
All right, so we're in the back of the ambulance. You're checking him how often?
I'm checking him every 5 minutes.
All right,
He is
so
unstable.
If you have time, what else are you going to do?
I'm going to go ahead and do a detailed assessment.
And reassess what you already did.
Correct.
All right, good. That concludes your test.
Oh, man, that was good.
58-year-old man.
I'm sorry.